Now I'm going to be talking about the MaleGU exam. Before I start this exam, I would gather all my supplies and explain to my patient what I would be doing. I would have my patient stand in front of me while I'm sitting down so that I can inspect his external genitalia. And I would be looking at the hair placement, and I would be looking for nits or lice in his hair, or any genital warts or lesions, discharge, foul smells, or any abnormally large testes, hydrocele. I would just be looking for any asymmetry or erythema with his scrotum and his penis. Then I would move on to his penile exam, and with gloved hands, I would examine the shaft of his penis. I would have him lift up his penis and look at the dorsum of his penis or of the shaft. I would be, then if he was not circumcised, I would have him retract his foreskin and squeeze on his glands to open up the urethra, so I can see if any discharge comes out of that. If he isn't circumcised, I would palpate the corona. I would do this anyway, even if he was. Palpate the corona and the glands, and I could squeeze the glands to open up his urethra meatus. After that, I would, and I'm seeing if any discharge is coming out. Again, taking a closer look to see if there's any genital warts or herpes or lesions or growths that shouldn't be there. Then I would move on to his, before I did his penile exam, I would look at his femoral and inguinal areas. I would palpate his femoral pulses, and then over his inguinal areas, I would rest both of my hands on his inguinal areas and have him cough to see if I feel any bulges that may indicate a hernia. I would check the horizontal and vertical inguinal lymph nodes and assess for any obvious hernias I may see there or feel. Then I would do the penile exam, which I just talked you through. After the penile exam, I would move on to the scrotum, and I would assess the scrotum for its size and its shape. Same with the penis, I would have assessed it for its size and its shape. And I would palpate each testy. I would find the epididymis on each side, and I would follow it up to the spermatic cord. And then from the spermatic cord to the inguinal rings, and I would palpate into the inguinal ring and have the patient cough to see if I feel any bulging or hernias, and I would do that on both sides. I would be feeling the testes for texture, size, and malleability, making sure I didn't feel any lumps, nodules, or possibly a hydrocele. After the scrotal, after I assess his penis and his scrotum, then we would move on to the prostate exam. The patient's position in this exam would be him leaning over a exam table. With a gloved hand and a lubricated finger, I would have the patient bear down, and before I stuck my lubricated finger into his rectum, I would assess his rectal vault and the rectal tone, his sphincter tone of his rectum. Through the anterior rectal wall, I would palpate his prostate. I would find the median, not succulus. I always want to say succulus, and it's not succulus. Median sulcus. Median sulcus. I would find his median sulcus. I would palpate each lobe, feeling for consistency and size. It should feel like a pencil eraser, and it should not protrude out more than 1 centimeter into the rectum, or else that would be a notable finding. After that, and while I was down there, I would look at his anus if I saw any hemorrhoids, um, and assess his tone, like I said before. And when I I would withdraw my gloved hand, from his anus, and give him tissue to clean himself up. Step out of the room so he could get dressed, and then come back and we can discuss any findings or if he has any questions. And that would conclude my MaleGU exam.